This week, we're pleased to welcome Plant-Based Health Professionals' own campaign manager, Sarah Bentley, to the podcast. Sarah's been working at Plant-Based Health Professionals U.K. for almost a year now, working on the Plants First initiative to promote a more plant-rich food culture in the NHS. And before working at Plant-Based Health Professionals, Sarah founded the UK's first vegan community cookery school and charity, Made in Hackney. The charity formed pioneering partnerships with the NHS, with Public Health Hackney and NGOs across the UK, and upskilled 500,000 people to adopt a more plant-rich diet. Her work has won many awards, and although she is no longer involved in the operational side, she is now an ambassador for Made in Hackney and has authored the charity's debut cookbook, We Cook Plants. But more on that later. So for now, welcome, Sarah.
Thank you so much for having me.
Thank you for coming on, Sarah, because we are absolutely delighted to be able to speak to you today about the work that you've been doing at the Plant-Based Health Professionals. But before we do that, as we've already heard, you're no stranger to plant-based activities. So can you tell us a bit more about how you got to this point in your career?
I can. I'll try to keep it short. I've always been interested in plant-based cooking from about the age of maybe 9. I went vegetarian for animal rights reasons. And then when I was 18, 19, I evolved to becoming vegan when I realized the dairy and egg industry was not how I had imagined it and how it was painted to me as a child. So there was always this interest in food and plant-based food. But my vocation, I was a journalist. I was a reggae dancehall music journalist. And when traveling in Jamaica, I was exposed to really incredible vegan ital food. And this food made my body feel so well and so alive and so nourished. I was like, wow, what is this food? And so that's how I was introduced to whole food, plant-based eating rather than just vegan eating. It was actually through my music career as a reggae journalist. So for people who don't know, ital food is eaten by Rastafarians, and it's a very healthy diet of whole food, plant-based ingredients with very minimal salt, sometimes no salt. And I thrived on this diet and I felt so well. And that really ignited a passion in me to learn more about it and share that with the world, basically. I didn't make it my career to begin with. I continued with the journalism, but I then got into community food growing, and that really lit my fire. And then finally, I left journalism to start Made in Hackney, the cookery school. And that's where I spent 12 years helping people to grow, cook, and eat more plants. So yeah, that's how I got here. That's probably the shortest I've ever explained that.
Oh, wow. And I think, well, this ital food, it's a little bit new to me, I think. So maybe we'll hear more about that when we ask you what you're having for dinner later, if it's still influencing you. Coming on to the Plants First healthcare, can we start right at the beginning with that and this campaign with Plant-Based Health Professionals? So can you tell us more about what it is and how it came into being?
Sure. So the Plants First initiative was launched before I arrived at Plant-Based Health Professionals. It was launched by Dr. Shireen Kazam and Rahini Bajekal, and it was in collaboration with 24 organizations. So it wasn't specifically a PBHP activation. It was an activation by a whole coalition of 24 organizations that was calling on the NHS to adopt a more plant-rich, healthy approach to the food they serve to patients and also the food that they provide to staff and visitors in their canteens. And so it started off like quite a traditional campaign where people were, calling on, the NHS leaders to make this evolution. But over time, it shifted into less of a campaigning project, but more into a collaboration and partnership initiative where we're working with other organisations such as ProVeg, Greener by Default, and My NutriReb and Real Zero on actually implementing programs within the NHS to make their menus more plant-rich. And what that looks like is completely different for every NHS trust and every geographic area. And the idea is that we meet people where they're at, where the trust's at, and what their patients want to eat. So if their current menu is 20% plant-based, we might help them to elevate it to 30 or 35% plant-based. If it's 70% plant-based, we might help them push it up to 80, 85. So it's really about looking at where the trust is at now with their plant-based menu and what their patients want to eat and expect to eat, and then helping them to push that dial up in a way that can be embraced by patients and the staff, rather than feel too extreme, too quick, too fast, and everyone reject it and push it away. So it's a slowly but surely approach to how we're going to make change happen.
Right, sounds good. And it sounds like something that no one could really argue with. But you mentioned some of the other organisations, so ProVeg, that have been doing stuff with schools, is it predominantly in the past, and Greener by Default, which of course have done all this work with New York hospitals. Looking at what they've done in other areas, what do you think that the Plants First Healthcare can really achieve for health and the planet?
We've basically brought Greener by Default over to the UK to do similar work that they've been doing in New York, in Canada, etc., and to really replicate it over here, but in a way that is bespoke to the British market. And so we're in partnership with Greener by Default, and where PBHB come in is we activate healthcare professionals and sustainability managers, etc., to care about this and to understand why a plant-rich approach is so important and how it can really help NHS trusts achieve their net zero targets. For some reason, people love to embrace local food and food waste reduction. That's a very all-encompassing theme that everyone's happy with. But when you start to introduce plant-rich, there can be some pushback. So we're all about giving health professionals and sustainability leads the data, the information, and the approach to try and get people to embrace it and to try it more easily. Once we've succeeded on that score, we introduce people to Greener by Default, who are our partners, and they can deliver a pilot within NHS trusts. And this can be different for every NHS trust. It might be a 3-month pilot, it might be a 6-month pilot, and they'll work together to make some menu changes, new dishes, work on the recipe titles, the dish titles, the menu positioning, and use all that nudge behavior techniques that they do so well to encourage people to choose a plant-based option. We're not really targeting the hardcore vegans or the hardcore carnivores because they won't change what they eat. It's the huge amount of people in the middle, the flexitarians, who, as long as the meal looks tasty and delicious, they're going to order it. The work is really targeting them to try and get them to choose the plant-based option and to get the options out of that veggie vegan section that no one wants to look at unless they're veggie and vegan, and just make them an integrated part of the menu. Greener by Default's approach is a by default. So if you've got 3 menu options, the idea would be that 2 at least would be plant-based and 1 would be meat. But what tends to happen now is 2 are meat and 1 is plant-based. So it's just switching things around so that choice isn't removed. People can still order meals with meat and dairy and fish in them, but the predominant options are plant-rich options. That's what we're aiming for. Now, at some sort of city, urban trusts, they're much further down the line with their plant-based journey, and it's a bit easier to introduce these kind of meals because they're already working with a lot of lentils, legumes, pulses, global cuisines. But if you go to other areas, I'm from Lincolnshire, Grantham, it's a small town in a rural area, we're a bit further back in terms of the plant-based journey. So it's really important there isn't just a blanket approach, and you work with trusts and catering teams as to where they're at now and what they can do to make those changes, those step changes that will be embraced. Because there's no point introducing a load of plant-based options that no one's going to order, or they order them and they send them back and there's loads of food waste and people don't get the nourishment they need when they're in recovery. So it's about having an approach that works in every trust individually. Greener by Default's pilot program, the idea is that they can track the data, see what works, see what doesn't work, make tweaks along the way, and then at the end of the 3 months or whatever time period the pilot has been for, look back at what's been successful, and then hopefully the trust can roll that out over menus going forward. Sounds easy, doesn't it?
I didn't know you were from Grantham, Sarah. It
I'm
almost
from
makes
Grantham
me
in Lincolnshire, yeah.
Well, it almost makes me want to ask you a supplementary. What would Maggie Thatcher have thought about all of this?
I think she would have been outraged. Yeah, well, you never know. But yes, I actually grew up very close to where she used to live.
It's interesting because obviously what you're saying is, you're meeting people where they're at, but within any particular city or area, you can have very different individuals, and almost like you wonder whether, if you are in an area which is considered to be less plant-based thinking, whether you could get a little bit left behind with your health. And sometimes those areas are the places where people need it most. They need to be stepping away from the traditional English breakfast the most. What do you think that these menus can achieve for health? Are you working with trusts to try and sell the health benefits as well?
I would love it if we were, but the message that's landing the most is the sustainability message. And it's a message of meeting net zero targets, of having more carbon friendly menus and having more sustainable food. Unfortunately, the health debate is a bit more emerging. Obviously, at Plant-Based Health Professionals, we know a plant-rich diet is extremely health supporting, but there seems to be more pushback with regards to that argument than there is the sustainability argument. We are, however, seeing more people embracing the need for a very fiber-rich menu, which obviously a plant-based diet lends itself to. So slowly, we're making these changes. I mean, I'm not the best person to talk about this, but, British dietitians from the BDA, many of them have said in surveys that Plant-Based Health Professionals has done that they don't feel adequately trained or prepared to offer expertise in plant-rich nutrition. So you can see why the health aspect is lagging a bit, because people aren't getting that adequate training to bring that into their professional lives. Obviously, some people have gone off and done their own research, their own training, and embraced it, and they can. But overall, there needs to be a lot more awareness and training done for dietitians and healthcare professionals generally, which is why PBHP is working so hard all the time.
Can we drill down a bit and actually get you to share some stories of maybe progress with hospitals so far, any particular hospital cases that you can tell us about?
Sure. So this isn't with a specific hospital, but something we're really excited about is we're about to produce 35 recipes for the NHS England Recipe Bank. And this is really fantastic because this is in partnership with NHS England. We're not at loggerheads with them, we're in partnership, which is wonderful. And I've recently had a great meeting where we discussed what recipes would be of most value for this recipe bank. Now, the recipe bank is used by trusts generally that have their own in-house kitchens and that they're cooking food fresh on site for their staff and visitor restaurants and for their patients. So we had a great meeting where we discussed what maybe some of the gaps are, how much innovation we could have in recipes, what type of ingredients, can we use things like aquafaba and textured soya protein, what's missing, what would the chefs enjoy? Apparently recipes that are plant rich that work for dysphagia, have I said that correctly, when it's hard to swallow?
Dysphagia.
Dysphagia, thank you, would be useful, and also energy dense recipes would be useful. So it's such a constructive and brilliant meeting. So we can now go away and provide, 35 recipes that trusts will genuinely find really useful. And those recipes are going to be created by us, My NutriWeb, Greener by Default, and ProVeg in collaboration. So that's really exciting. You did ask about trust specifically. The Royal National Orthopaedic Hospital, they did a pilot with Greener by Default in their staff and visitor canteen. When they started, their plant-based options were about something like 35%, 40%. And then by the time they'd finished doing the pilot, they dialed it up to 50% consistently, not taking away anything like meat-free Mondays or meat-free on a certain day of the week, but just consistently having 50% plant-based options on their menu. They did try up to 60%, but apparently they got pushed back and they saw a drop in sales. So they're leaving it at 50% for now, but with the intention to slowly, surely keep dialing it up over a period of time. So that's really exciting. They've made some of their barista machines in the restaurants oat milk as default, which is really cool. And it's just these step changes that slowly but surely you embrace. To get the staff to be on board with this, they've done really cool things, like they've had plant-based recipe sharing, how much carbon is saved on certain recipes, plant-based nutritional advice being put on tables and on staff intranets. So to really kind of create this plant-rich, positive space. So if you're feeling a bit, oh, I'm not sure I want to try that, or I've heard it's not healthy on social media, you're sort of trying to sort of drown that out a bit with stats and data to create that positive feeling about why there's more plant-based options and why people should choose them. And it's going really, really well there. So that's really cool. We have one more really awesome pilot in the UK, and that's going on with Nuffield Health. So obviously a private provider. They're working with Greener by Default and Sodexo, who are a large catering company. And the pilot is happening across all of their UK sites. So it's a massive pilot, and it's going to end around middle of October time, and we'll be going to shoot a documentary there in a couple of weeks, and then we'll get some fantastic UK data.
Oh, amazing. And I mean, mentioning the Royal National Orthopaedic Hospital first off just sounds, I mean, I think me and Daisy probably share the same view that some of the most challenging letters that we get as GPs are from orthopedic surgeons telling people to have lots of dairy and things like that. So the fact that that pilot's happened in that hospital is absolutely amazing.
Can I ask a quick question, Sarah? You mentioned they're 50% now on their menus. What sort of targets do hospitals need to reach to get to that net zero NHS net zero goal?
So I don't know in terms of plant-rich specifically, because they're edging towards that goal with lots of different interventions, whether that's food waste reduction, local sourcing, or whatever it is. And so that's one of the problems. We don't really have a specific target for this is what your plant-rich ratio should be in order to meet that, because people are going to meet it by doing all sorts of different things.
I was just going to say that actually, you know, even when you're talking about this, I'm well aware of some of the challenges and I can feel the challenges that you've been facing. But any particular comments on challenges that you've overcome so far where you've perhaps even surprised yourself?
I guess in a way, because of my experience at Made in Hackney, everyone we worked with in that community cookery school, 99.9% of people were not vegetarian, not vegan, and had no plan on being so. So I'm quite used to working with people and encouraging them to embrace plant-rich eating without pushing necessarily a vegetarian or vegan agenda. It's just to positively embrace eating more plant-rich food. And if you decide to make that decision later down the line, that's awesome, that's amazing. But if you just decide to eat way more plant-rich meals, that's also a massive win for the health and the planet and for animals. So I'm quite used to being in that space. So when I started working here and started to get in touch with trusts and talk to them about the campaign, there was definitely this idea that we were talking about 100% plant-rich menu with no animal products. And that's what a lot of people thought the campaign was calling for, when actually in an NHS setting, when that food is unfamiliar for many people and they're ill, possibly dying, it's maybe not appropriate to put something that's so new to them as their only choice. And so there was this misconception around what the ask was, and people had misunderstood the phrase plant-based by default, rather than thinking the base of the menu, the foundation of the menu, and the majority of the menu is plant-rich, but you still find your meat, dairy, and fish. People thought the whole menu was entirely plant-rich, and all of that would be taken away in a hospital setting. So there was this confusion, and because of that confusion, people really had their backs up and were really like, we don't want to do this, we don't believe in this, we morally disagree with this. I had every type of response: morally disagree, we don't want to do it, it's not right, patient choice, when people are dying they should be able to choose. You know, we had so much different pushback. But once people understand, actually, we're just about supporting people to improve their plant-rich offer, to elevate their plant-rich offer and walk towards it as fast as possible, but in a way that doesn't alienate your patients and your staff, then people are like, now we're listening. That would be really helpful. Okay, maybe we can start working together and collaborating on that. So it's getting it to be seen as collaboration and a partnership, rather than people are being got at and sort of being told they're not doing a very good job, which they are. People are working so hard in NHS kitchens to feed thousands of people on really low budgets with really challenging staff turnover. how annoying for someone to pop up and go, I don't think you're doing your job very well, when they're like absolutely slogging all the time. But if someone pops up and says, hey, maybe we can help, maybe we can collaborate, and together we can work on, getting some of these plant-rich options more out there and chosen more, that kind of lands differently and feels different to people. So I think we've got over that hump now, and people are more open to the collaboration and to embracing the skills which the group of organizations has such incredible skills. ProVeg, Plant-Based Health Professionals, Greener by Default, it really is a full service we can offer people. And I think finally, trusts and healthcare providers are starting to realize that and think, okay, I think we can work with these guys.
And Greener by Default are offering this for free. Is that right, Sarah? Is
That's
that still
right.
the case?
Yeah. So we're all
Amazing.
offering the work for free. Yeah. So it's obviously staff time and capacity. So if you're really up against it, you've got a high staff turnover and you've got to cut budgets, it's really hard to find the headspace to then, I've got to do this whole other thing, this whole other pilot.
Yeah.
We need to find trusts which have quite a stable staffing level and people that have the capacity and the appetite for doing innovation work on top of their already busy workload. It's obviously a bit easier in trusts where they have dedicated sustainability leads, because that's their job to push forward innovation. But what you find that in a lot of trusts, it might be the estates manager or the soft facilities manager who've got sustainability slapped on top of their already busy role. That's quite challenging. So we appreciate the different tugs and pulls on people's time.
Sarah, I do want to come back perhaps to Grantham Hospital, but just to find out a bit more about what challenges are remaining. And you said that, some areas are going to be less embracing of plant richness than others. So what challenges are there still, and how can we tackle these?
All the challenges still remain, except for the perception of the campaign hopefully has changed, which is great. But the biggest challenge is, like I said, meeting trusts and teams that have the capacity to take on a pilot project or to implement innovation on top of their current job. We have trusts that are super interested, really positive. It's really hard to get the pilots to kick off because there's been staff turnover or people have been off sick. So it's just getting that staff consistency to get the pilots off the ground. That seems to be quite a reoccurring problem, and a reason why quite a lot of the pilots get delayed from starting on their starting date. So we just need to keep being persistent, keep going, keep being supportive, and we will start to see those pilots happening. And then I think once we've got a few really great ones going, it will just be like a domino and more people will want to do it, and they'll think, okay, that is really valuable and that can really help us achieve our targets. I'm an optimist, so that's how I think it will go. And also we're going to be working more seamlessly with ProVeg and Greener by Default. So we'll announce that in the coming weeks and months. But I think once we've got a coherent working group of organisations, other NHS trusts will really see that we're such a great resource for them to draw on, that hopefully that will bring in more interest. So instead of us chasing trusts to do these pilots, hopefully the trusts might start coming to us and actually ask, how can they kick one off in their hospital?
You have got some resources for them to look at if they're a bit shy about engaging Greener by Default first off, haven't you, to sort of like help them understand what they're perhaps getting into?
So Greener by Default has a really amazing introductory presentation. It takes about 25 minutes to listen to it. And we do that live in meetings. It's not actually available online because we like to be able to answer questions. And every single trust has a unique set of challenges and a unique set of what ifs and what buts that we like to answer. So we currently don't have a toolkit for soft touch engagement, but we will be creating one in the future with our partners. So watch this space for that.
Okay, that sounds good. So basically, if people are listening to this and they're feeling inspired and they're thinking, I've just been into hospital and, or if I'm working in a hospital and our canteen food is still terrible, is there still a role for them to help as non-catering staff with getting things on track with this initiative?
Absolutely. So if you're passionate about food in your NHS trust, you can have a meeting, you can ask to speak to the catering manager or the sustainability lead, and you can talk to them about plant rich and why you feel like it's a good way to go. And then hopefully if they're warm to that, you can put them in touch with us and we can start off having those initial conversations with them about what this looks like and how it could benefit them. So yeah, we would like as many introductions as possible to different NHS trusts.
Right, that's noted. Hopefully our listeners have heard that and will take some action.
So besides our work with NHS trusts and with Nuffield Health, we've also just created a toolkit for Royal Colleges, societies and associations, which are the entities that look after medical professionals in their particular fields of expertise. Now, we've created this in collaboration with UK HAC, which is the UK Health Alliance on Climate Change. And initially, we've done a launch for their members only to present the toolkit to their members, but it is now live on their website for any organisation to see and be inspired by. And what I love about this toolkit is really, really practical. How to communicate about having a plant-rich food culture at your organisation with your members, how to explain the reason why without getting people's backs up, like making people feel like they've had something taken away from them, how to communicate about it in a really positive way. It talks about how to brief caterers. We've got sample menus in there. We've got loads of beautiful pictures of great plant-based food, and we have really good case studies with different organisations that have adopted this approach at their AGMs or for training residentials or for team meetings, and how they did it and how they made it a success. And also in the toolkit is their contact details. So if you want to get in touch with them for some nice peer-to-peer learning and support and advice, you will find all of that in that toolkit. So that's really exciting.
That's brilliant. So that's really the place to go if you're a healthcare professional who's interested. And we'll put those links, obviously, in the show notes for this episode. And just to clarify then for listeners who are not healthcare professionals, can they reach out directly to you, Sarah?
So if you want to see changes happen in your local hospital, you can get in touch with me. It's Sarah at pbhp.uk, and I can have a chat with you. It might be that work has already started in your trust and conversations are already happening and you're not privy to, or it might be that there's a pilot in the pipeline, or it might be that it would be really helpful to do some uplift work there. So it's best to get in touch with us and then we can see where things are at.
Brilliant. Sounds excellent. So you go, listeners. You heard that here. And yeah, good luck with all the work you're doing with the initiative, Sarah. It sounds absolutely brilliant, much needed. But moving on to your other work, you're also an ambassador for Made in Hackney. We need to know about the book that you brought out. So tell us a bit more about that.
So everyone listening, I'm actually showing the book now with a massive grin on my face like a toddler because I'm really excited about this book. This is Made in Hackney's first book, We Cook Plants. It's got 100 global plant-based recipes in it from 60 different chefs. It also has so much more stuff in it than recipes. It has loads of juicy discussions on things like regenerative farming versus organic, how to access plant-based food on a really challengingly low budget. And we talk about things like cultural appropriation in food versus appreciation. We talk about the idea of decolonizing the food system. We talk about fat phobia in food. There's so many juicy topics in this book. It's so much more than a recipe book. And there's also a food growing section at the front, and that's my real passion. I'm a really advocate for food growing, home growing your own, even if it's just like a few sprouts on a windowsill or some cut and come again salad or some herbs. It just really connects you to the seasons and to the magnificence of food and the whole process of growing food. So if you can just do that on your windowsill, then you feel more in tune with your food than you ever have before. So there's tips in here for how to have a little mini allotment on your windowsill or on your kitchen table or your balcony. So yeah, very, very proud of this book. And it was a huge effort, like bringing it all together because there was over 80 contributors. So it was quite the spreadsheet was pretty wild.
Wow. Congratulations. It looks amazing. And it was going to be on my Christmas wish list, but I don't think I can wait that long. I'm going to have to get it sooner than that.
Yeah, you're going to have to get it sooner than that.
Absolutely. Sounds brilliant. Well done. Yeah, many congratulations.
Thank you.
And on that note, what sort of role do you think cooking schools like Made in Hackney and all these wonderful recipe books and plant-based books that we have that can actually play? What sort of role can they play in this space?
They're so crucial. Like I said at Made in Hackney, most of the people walking through the door were not vegetarian or vegan. So they were coming, they didn't know most of the time they were coming to a plant-based cookery school. And that was on purpose because we know people come with a certain amount of prejudice or skepticism about plant-rich food, it not being for them, it not being satiating, it not suiting their culture, whatever it is that is putting up their barriers for embracing it. So we often didn't really share with people that it was plant-based. We would say, come and enjoy healthy, affordable, delicious, international food, learn new skills, make new friends, all the positives around it, often without mentioning the plant-based aspect. And that was because once you actually get people in a kitchen, trying the food, cooking the food together, if it's delicious, you don't need to do any propaganda. You don't need to do any convincing. The food does the talking. And so if they've had a good time and they've been excited by these new ingredients they're exposed to, they're going to come back the following week and learn something else. And then maybe the following week and learn something else. And it does take people a while for their palates to adjust because our kitchen at Made in Hackney, it's low salt to no salt, low sugar, low oil. You know, it's a very health conscious kitchen because people come with all sorts of ailments and conditions and we need to support them. So sometimes the food, if you're used to very high salt, oil, fat foods, can taste too clean. But if someone comes on a course for 4 weeks, their palate really begins to change, and you see this amazing transformation where people who are sort of picking at it originally, looking a bit scared, going, "Ooh," because it's unfamiliar. Unfamiliar food is a bit can be, for some people, can be difficult. 4 weeks later going, "I'm actually really enjoying this. I can't believe it, and my husband's enjoying it, and my kids are enjoying it, and I made those 15p bean burgers you told us about, and I made this and I made that." And it's so cool seeing people's food horizons open and to slowly but surely start to embrace more whole food plant-based ingredients, but not because they've been lectured at, not because they've been scared by their doctor, but because they've actually just had a really good time in a really supportive environment and cooked some really delicious food. And they're like, hey, maybe I can do this. And these schools up and down the country will be so important to helping people make that transition because, you know, in the UK, lentils, beans, legumes, seeds, etc., they're not really part of the modern traditional diet for many British people. We're obviously influenced by our incredibly multicultural and diverse population, which is such a blessing. But for some people, those ingredients are still very new. But if we're going to make our nation's diet more sustainable, we will really all have to embrace those kind of ingredients and get used to cooking with them and enjoy cooking with them. I think the government should be funding a whole network of community cookery schools for across the whole nation to build this skill. But whether they do something that innovative and useful, I don't know if I'm that optimistic.
Yeah, because presumably people that you say enjoyed the food also felt better in themselves, just anecdotally. Did they
Yeah,
get the health benefit?
absolutely. Like we
Yeah.
have so much anecdotal evidence of people saying, I felt more energetic, or my blood pressure went down, or I've lost weight, or I feel happier. Why do I feel happier? We've really fun comments like, I felt I got out of bed with a spring in my step for the first time in years. Like, so cool, the variety of positive feedback on people's health anecdotally is just gorgeous. And it's what really motivated me when I was running the cooking school to keep going, because it's such a slog running a charity and fundraising and keeping the lights on and everyone paid. But then someone would ring up to book a class and go, oh, my insulin levels have gone down, you know, and you'd be like, what? And they'd be like, oh, I've been coming to your classes for 6 months now and I take less insulin, you know, I'm diabetic and I don't need as much now. And you're just like, oh, wow.
Amazing.
That's amazing.
Yeah.
And it just would give you that jolt of inspiration to keep going with the funding bid or keep grinding through whatever you were doing to keep everything open, because it really does change people's lives. And yeah, it's such a potentially easy thing, potentially. We work with a lot of people who don't have access to kitchens, they live in hostels, they live in shelters, they don't have much jurisdiction over their food supply. So it can be really difficult for some people. But for a vast majority of the population, it's actually just about switching up what you put in your basket and cooking something slightly different. And so there's such a large amount of people who could make such a positive change to their life if they were just introduced to it in a way that felt non-threatening, fun, and embrace their cultural foods. And then we'd see so much more diet change than what we're doing now. We need thousands of Made in Hackneys, and there's other cooking schools popping up like Joyful Greens, Love Food CIC. There's a whole cohort of new plant-based cooking schools, which is fantastic. But we need hundreds.
Well, that was going to be my exact next question. Yeah, I mean, you're absolutely inspirational. And, if this is something that someone has been inspired by listening to you and going to Made in Hackney, is it something that would be possible to replicate elsewhere? Where would people start if they were interested?
So yes, we have set up a program specifically to help people set up their own plant-based community cookery schools. It's called Global Plant Kitchen. You can find the website online, and you will find an online course detailing everything you need to know to set up a plant-based cooking school, from the lesson plans, the recipes, the marketing, the fundraising, you name it. We've put it all up there as a sort of how-to course. This course has been downloaded and worked on by 184 different participants from 30 countries around the world. I think that's just awesome. Now, I've no idea if they've actually gone ahead and started those kitchens, but that's super cool. And then we've been mentoring groups from Manchester, Exeter, Cambridge, Surrey, and Folkestone, who are all in the process of starting or finessing and elevating their plant-based schools. And this year we've been mentoring people, a group in Peru and a group in South Africa. And prior to that, we also were mentoring a group from Macau. So very cool. It's going global.
That's amazing, Sarah. I just feel so inspired listening to you. I feel like I want to open up a plant-based community kitchen.
This is exactly what I'm thinking. There's something Sarah said earlier that really made me laugh, where she said, we really get the success with patients changing their lifestyle through bringing them in to cook, because it's not about the doctor scaring the patient anymore. And I thought, yeah, that's what I need to stop doing. I need to stop scaring patients and get myself into the kitchen and doing a global plant kitchen.
Think about an awful drink like Coca-Cola. They've managed to get the world to start drinking this drink by selling it, by talking about love and community and special occasions. That's how they've sold us this drink. And so getting people to do things, fear works for some people. You get the scary stats and you go, oh my God, what am I going to do? I'm going to do something about it. But for most people, actually joy and having a good time and feeling good makes them make the change. And more people, I would wager, fall into that basket than into the other basket, because fear often paralyzes people. You don't act, you kind of get depressed and stupor and sort of can't do anything. And then you just go back to doing what you were before. Yeah, I'm actually quite motivated by fear, but most people aren't. And so having this sort of joyful environment where people can kind of embrace the change in a supported way and make new friends, for many people, that just works more successfully. I remember back in the early days of Made in Hackney, I went on a supermarket tour with a dietitian from the local hospital. Now, I don't want to drag the dietitian because she did a great job explaining about the supermarket, what to eat, what not to eat, but the focus of the tour was mainly what not to eat. So everyone joined the tour looking all chipper with diabetes patients, and by the time they got to the end of the tour, they were like this, really sad, and the shoulders were sagging because it had predominantly been about what you can't eat. It felt like deprivation and giving up everything they love, rather than spending most of the tour talking about all the amazing things you can eat and bringing those to life and celebrating those and doing a quick whiz through of what best to avoid. And in that moment, I was like, yes, we're definitely onto something with Made in Hackney, because this does not work. Because, I could see afterwards they were just all like, oh, because it was too much. It was too depressing. It's like, who wants to eat like that? And it was just the way it was delivered. It was factually correct. They were fantastic. All the information was there, but the psychology.
We've always said this, haven't we, Claire, that it's such an abundant, delicious diet. It's just a joy to eat this way. There's no deprivation, is there?
No.
Fantastic. And on that note then, can you tell us what your joyful, delicious dinner is going to be tonight?
I'm really sorry. I've no idea what my joyful, delicious dinner will be because my husband's making it downstairs. But I can tell you what joyful, delicious dinner I had last night because it was really nice. It was Afghan-style bean curry with turmeric rice, with red onion and coriander. So the plate is bright yellow, bright red, bright green with a bit of red onion on top. It looks beautiful. And this recipe is in Made in Hackney's We Cook Plant book. And I enjoyed it last night. It's super simple. It costs pennies to make, and you can be really distracted. You can probably tell I've got ADHD. You can be on your phone, you can be talking to someone, and you still can't mess up this dish. It's like ADHD proof. It's fantastic. It's so simple. It's just a one pot affair, and it's really tasty. The main flavors kind of cumin and tomato smokiness. Delicious.
Oh, sounds great. We love a one pot. And is that recipe in the book?
It is in the book, yes.
Oh,
yes. So are all the recipes ADHD proof, Sarah?
I'm afraid not. Some of them, yeah.
Oh, no.
As we're a cooking school, Made in Hackney, we have simpler recipes, beginner recipes, right through to recipes that people learn in our masterclasses. And people want elevated skills in those classes, so it can get a bit chefy. So some of those chefy recipes are in the book because we wanted to offer that broad range of skills. But there's also lots of sort of simple dinners, dinner in under 30 minutes, one pot recipes in there, alongside a few of the more advanced chefy ones where, you have to concentrate. But we've laid out the recipes in a way that's neurodiversity friendly. All the points are numbered and all the steps are explained in full. There's no presumptions about cooking. So we've tried to make it as user-friendly as possible.
Brilliant. So something for everyone in that book by the sounds of things.
Yes.
Maybe something for my dinner tonight.
Oh, yeah.
What's your dinner tonight, Claire?
Well, I knew you were going to ask, but I don't actually know for sure. I've got another recipe book on the way. It's one of the ones that Daisy, so it's one of those review ones. So it's called The Cycling Chef. So it's all about plant-powered performance tonight. And I've got the stuff so that I can make the cauliflower, kale and chickpea salad. But that doesn't sound like it's going to fill me up. So I'm definitely going to cut up some tofu and just do that in the air fryer as well.
Oh, wow. Okay. So it's going to be like a blend of various different things.
Yeah. It's a salad. I know that the kind of plant-based salads, when you really go for it, they really can be substantial and more like a Buddha bowl. But I love tofu so much. I never miss an opportunity to add it to a meal.
Great idea.
Even though I ran a cooking school for 10 years, most of my meals are not dishes. They're heaps. And in my house, we call them heaps. And on a heap, you have a grain or a carb, you have a protein, and you have colour. And that's how I think, and some fat, so in a dressing or a sauce. So, it might be quinoa, tofu, and loads of veggies and a salad dressing on top, or it might be, whatever it is, that's how I think about it. And I go into the fridge and I might just cook a grain, put a protein on, throw some veggies on there, and it's done. And there's no name, there's no dish. It's just delicious, and that's what it is. And that's how I eat most of the time. It's when I want to cook, you get the recipe books out and you make something with a name. But most of the time, it's a heap on a plate, a colourful.
I think that's great. There's basic principles. You've got all the macros covered. You've got your different coloured veggies. Yeah, that sounds great, Sarah.
It works.
But when Daisy cooks, her presentation is really good. So I'm not even going to ask her if are you making a heap tonight, Daisy?
It is a bit of a heap actually because we've run out of food. I need to go shopping. There's hardly anything in the fridge. So I'm a bit like you, Sarah. When I've got nothing left, I'll just be like, right, what's the protein? What's the vegetable? And what's the grain? And it's a bit like that tonight. So I've got one block of tempeh left, which is great. I was very happy to see that in the fridge. And I'm just going to just very gently pan fry it and then add some spices to it so it becomes like a tempeh bacon type effect. So if you cut it really thin, add lots of paprika and soy sauce. It's really lovely and smoky. And I've got about half a red cabbage left and a few carrots. I'm going to make a slaw, and grain of choice. There's always grains in the cupboard, thank goodness.
So before we wrap up, can I do a little quick plug? We have the Plants First Healthcare website, which everyone can go on to, and you can find the steps on there for how to take action on the Take Action page. And then if you're interested in Made in Hackney's cookbook, you can go to madeinhackney.org, and the proceeds from the book go to the charity. So you're not only getting a really awesome cookbook, but you're also, raising money for a good cause. And plant-based health professionals, Dr. Shreem Kazam and Rahini Bajakal and Dr. Nitu Bajakal all contributed to the Thrive on Plants nutrition chapter, which is a really easy, super digestible, it's about 6 pages tops, all you need to know to nail your plant-based nutrition. And so that's in the cookbook.
Fantastic. We'll make sure all those links are in the show notes. Oh, Sarah, it was great chatting with you. Thanks so much for your time.
Oh, yeah, it was great.
Thank you.